here to the anterior upper leg. Here is a place where if I have a little bit of a thing, it's like make sure the sheet is always contacting the inner leg. There's a security thing, so sometimes I just make sure my hands are holding it down as I'm doing the movement stuff. This is a good security thing for the client, right? Because this rhythmic oscillation can be done really good here for the hip. IT band, everything. And if I was thinking lymphatic drain, what would I have to do? I have to start very proximal, but my applications would start distal and work proximal. So that's what lymph drain would always look like. Is here, moving as much skin as possible. This is where I do a two-hand actual fingers apart kind of action. Just moving the skin, moving it towards the body, and a small twist. That's all it is. Anybody that wants to make it more complicated, I'm sorry, it's not.
Very light pressure.
Incredibly light. You want to be feeling like you're only moving the skin. I consistently am probably applying a little bit too much pressure for demonstration purposes so you can actually see it. But in reality, it's much more like this.
I can't believe that can be everything.
I know. Now, that's part of the issue. Sometimes just the contact can be soothing, but there are people where somatically that's not enough. So if they just feel this happening, they'll go crazy. It would be very irritating to me to just have nothing but a lymphatic drain massage. At the spa, we have incorporated a different kind of formula which involves like the dry brushing and all of that. So you have a bit more, now that's still superficial though, right? Using the dry brushes and everything. But there's more somatically happening, and then you're getting some other effects with histamine and all that with that. So, but the pattern alone, even if it's just a little bit of this, like a little bit here, sprinkled in, and then going into the massage part. But this oscillation effect, I promise you, is just one of the unspoken heroes for lymph drain. Because of that rhythmic distortion of what it's doing in the joint capsule and the lymph nodes by the joints. That's what it's about. Now, for working on the upper leg in this orientation. Couple of things. If it's particularly sensitive for people, and it hurts. Now, this doesn't work with lymph drain, but we could do the more superficial stuff here.
Oh, excuse me.
But this tends to be what will feel more gentle. So you place your palm very much on the lateral side, just anterior to the hip joint, like the greater trochanter is just over there. And then I just try to glide down. Just glide down towards the knee.
What are you doing again? Like what's...
This would be working on, some aspects of IT band and the lateral quadriceps. So specifically it'd be vastus lateralis, which tends to be the most sensitive quad. And people talk about tight IT bands and all that kind of stuff. Usually IT band is stuck to vastus lateralis. And so freeing that up is important. The other reason why I might do this is to actually pull the quads, the tissue related to the quads in the anterior upper leg towards the knee, because they're having knee issues, the most common of which would be patellar tendonitis. So think about the sitting position. What's short, what's long? This is short, here's the cave, here's the hill. So usually what happens with patellar tendonitis is that a person's, because you have muscles that work at the knee that attach up here at the hip. So if this gets short, we end up applying a lot of tension onto the patellar tendon and the patellar ligament. And then the symptom will start manifesting here. And Sometimes you do need to work here, but more often than not, if you free up this, now suddenly that tendon and ligament has some breathing room. So you have knee issues, especially related to what is anything patella, anything patellar pain, okay? Pulling the quads away from the hip and approximating them towards the knee is the go-to. Now that could be thought of from a connective tissue standpoint. I'm just pulling the fascia towards it, but more it's about trying to just bring the muscles. In this case, it's going to be predominantly the proximal aspects of the quadriceps muscles, all of them. More specifically rectus femoris, which is the top one, but just trying to pull that down towards the actual patellar tendon, but they come together and meet in order to move the patella. But that is usually more effective and much more kind than this stuff. Going right down on top of that tendon and then pulling up and away from it will feel intense, but it's kind of usually just brutality for the sake of brutality. It might work if you do it enough, but this usually, if you can just get your people get worried because they don't want to be too close to the pelvis. So I have to make sure my hand is pretty lateral to start. And this is the one time where I make sure my arm is oriented like this rather than like this. And I can draw everything down towards the knee. You almost always, but would the amount of pressure I'm applying now, if I did it in the other direction, it would feel like it's too much. It would hurt too much. But going in this direction seems to, I actually don't always have the best explanation as to why, but this seems to be more forgiving and it feels less ouchy to me. But the direction of application is contrary to lymphatics. So then I balance it out with a little lighter pressure going in the other direction. Like that.
So ideally, lymphatic could easily be treated without, can easily be incorporated, and you seem to do
Yes.
that, which is what you've been saying.
And that's
right?
the biggest thing that is actually a good point to bring up. I don't understand why the concept of just always incorporating it isn't talked about more. Because people want to just make it its own separate session, its own separate thing. And I'm like, you might as well just sprinkle it in all the time. One, so that your pattern, your sequence of touch and application isn't too different, right? You get somebody that needs that kind of support, and it's only going to get more, I know these are targeted. It's only going to become more and more important as the medical arena is kind of locked in on the importance of facilitating lymphatic fluid movement in manual therapy. So there's more people, more of the public, more of your clients are going to come to you asking about lymphatic drain. It's just it's not gonna change. And so you want to be ready and saying, no, it's always incorporated. And I can chart every single time that I did manual lymphatic drain. Because I did. I can justify it. There's the joint movement, applications that start, proximal to distal, and touch applications, or not modalities, but techniques that apply forces that are distal or proximal. I can justify it every time. Now, back to quick anatomy lesson. Hip flexors. Psoas is the big one. But we've already worked a little bit on psoas, and I'm not going to put her through that. Her issues are not related to sagittal plane. I think I would see how much benefit we could get without doing a manual psoas release.
Okay.
Work on the lateral fay. Don't worry about this to start. Then here, this cool, like 3-prong meeting point. It's like if I put my fingers like this, how they all come together up in my hand, right? You have sartorius that tracks from the anterior superior iliac spine, and it shoots off medially and attaches all the way over here. What's called the pes anserine, also known as the goose foot. Nobody uses these terms anymore. Sartorius does hip flexion, external rotation, and knee flexion. All right, tensor fascia lata. See how they create a upside down ube? But here, that controls the IT band. But look how tensor fascia lata, which is the muscle of the iliotibial band, comes over on the lateral side of the knee, sartorius over to the medial side of the knee. So it just hugs the lateral and medial side of the knee and controls aspects of that, very stabilizing it. Sartorius actually is a mover of the knee in flexion. Then you have rectus femoris, the top quad, which also attaches here, just underneath, and is the biggest of the quadriceps group. So it's related to hip flexion and knee extension. So they're all synergists for hip flexion, but then they have different things that they do. Rectus femoris, only hip flexion, but then also knee extension. Sartorius, hip flexion, but also external rotation and knee flexion. Guess what latissimus dorsi does? Doesn't do any flexion extension, does internal rotation. So antagonists. Here, antagonists. But then also synergists. They get confused too, because it's confusing. So it's an area where a lot of confusion and a lot of layers exist. People don't work here because they're scared of the pelvis. But that's where just getting that application and getting confident with it, just like working on the glutes through pro. So it's this one, so my hand's not here. You've seen this enough now where it should just feel like you're numb to it. But I'm going to be more specific in finding the anterior superior iliac spine, making sure I'm compressing there, maybe tracking just a touch medial or just a touch lateral to be more specific. And then, what is pretty neat is there's a really easy action to use here to try to free up everything. Try not to be cruel.
The pressure is fine.
Okay.
You probably go a little more.
What would it be like to be cruel?
Or just be. There were plenty of people. I've had to decondition myself because there was a stretch of just everywhere was me just being as I just called it Hulk power. I just had to just bring Hulk smash energy to the massage, and that's not what most people need.
So what you're doing right now is the equivalent of the one on the shoulder where you had the hands right on top of each other, right?
Yes. Related to the posterior compartment where there's a lot of layers meeting at the shoulder joint. Yes, absolutely. Absolutely correlated. Yep. Now, I have a choice. I could be thinking about like actions related to the knee, but I could just think about actions at the hip. And what's the easiest one I could have them do is actually rotation. And we're related to low back dysfunction. Remember how I mentioned that typically people will lose rotation in one, now it's actually the other, this leg's the limited one. So now all I have to ask the client to do is roll your leg to the inside. Super easy action.
The back side, don't you?
That's probably related to the stress we're putting on the SI joint.
Okay.
And slowly let go. Incredibly easy action. So this is your new one. I probably have shown this some, but just like what Javier was saying, with the posterior part of the shoulder and prone, having a person straighten their elbow and then roll their shoulder, this is comparable to that. Where a bunch of layers of muscles meet, hear the same thing, but that should feel good to do,
It
and
does.
it's easy to do. There's not anybody I've found that can't lift their leg inside line or can't do this rotation. So you have somebody, a classic one would be osteoarthritis of the hip, right? You want an action to do that's going to be effective but not potentially harmful. This is it. And this is the big go-to. Now I have to be thorough. I started here, thinking a bit more sartorius, and I have to just come over a little bit further and focus on tensor fascia lata. So I'm here, come a little bit more lateral, increase my elbow angle. It's just like doing the low back. And I get to start on one part and just come a little bit further over, closer to myself. This one may be a little bit more grouchy. Now, if you can get low enough and more lateral, you can even affect gluteus medius and minimus. Minimus more specific. Okay, go ahead and roll. There we go. Once she's activating, I can feel the muscle and I can be more targeted with my pressure. I just feel for where the muscle shortens and then I'll just move over a little bit to be more on where I feel the contraction occurring. I'll let go. So having a person do the action can actually just help guide you. Yeah, and now we're really more on it, right? And then I can watch. I watch how far do her toes go into internal rotation. Come back. And ideally, what I see and feel is a smoother action as well as increased range. And there was, as I coached it. 4. And then again. And that looked a lot easier.
I thought it was better, yeah.
Suddenly the movement looked very unrestricted. And then rhythmic rocking. Yeah, I show all of this, and I'll do this usually overshoot, to be honest. There's this, or there's this. All the same. Okay. Let's balance her out. How are we doing time-wise? Where are we at?
140.
Okay. It's just sideline for you, so it'll be all right. Okay, real time. Some biomechanic stuff may not be perfect. This is the one that I know isn't perfect. This is kind of my swoopy one. This is my Swedish massage effleurage action. Don't do it again. Then some knees, with my pull hand only being close to the knee, so that my hand isn't, open palm isn't too much of the medial thigh. And a bit more targeted. That was a tight quad. As I worked a little bit deeper, I felt that kind of speed bump roll.
The side was all
And kind of cool to be able to like recognize those underlying asymmetries. Probably, because the hip flexors will always be a factor with everybody. You know, we built the world so we could sit down more. That's how it is. So hip flexors will always be tight. And related to low back dysfunction, you have to always address them. Now, I'm keeping my direction of force this way to be more nice, okay? There's no swelling issues. So I don't have to worry about the lymphatic system. It's doing fine. So you're not gonna block it the other way. It's not. It would be much worse if we went the other way. So I am now on the quadriceps muscles, which are more related to knee action. Thus, what would be the muscle under technique I would do? Remember the firing pattern stuff? I'm gonna have you just push the back of your knee down into the table so we get those quads together. Perfect. Let go. That's what we're looking for. So I coach them. Now you're okay. Once you're activating, it should feel much better. She said she felt scared. Let go. Remember what I said always about these muscle lunge techniques. What they almost always should do is what you're pushing on. Once they contract it, it should feel better. not worse. Okay, activate. Great, very good.
So weird.
And hold it. Hold it, hold it. And slowly let go. Good. I did not feel
When
the
I
clip.
released it, something clicked.
Can't say where it was the clip.
I couldn't tell if it was under your arm or in my knee.
Into
Okay.
and activate. Probably the patella.
Yeah, probably.
So look how slow I'm going. This would be closer to a myofascial concept. I'm holding the tissue on tension and just really holding it there on tension. All right, activate. That feel a little easier.
Mhm.
And let go. More often now, I look and feel for the ease of movement as opposed to a muscle actually fully releasing. And I felt something stuck right there. So I'm going to try doing transverse based application, meaning I'm just running perpendicular to the muscle fibers.
Still moving across there, forward.
You can think once you really start getting the anatomy figured out, like look at that model just behind the couch.
Mhm.
So you can see those pec fibers. You can visualize that. And there, look. You can see it in your head. You want to think, can I go with the grain and against the grain? Go with the fibers and then against the fibers. With the fibers lengthens them, and against the fibers bends them or pries them off of underlying structures.
So right now you're doing across the fiber.
Yes, yep. The limbs are easy because predominantly the fibers run parallel to the skeleton. So it's not freeing up. Now I have to decide. You can't be too cruel, but I have a sense of what this is. So layers are layers, and layers like to get stuck. Underneath of rectus femoris is the other vastus muscle, the other quadricep muscle. So underneath rectus femoris are the three vastus muscles: vastus medialis, vastus intermedialis or intermedius, and vastus lateralis. Rectus femoris and intermedius do like to get stuck. So the action is the same. It's not firing patterns. It's me trying to unstick the top muscle from the muscle just underneath it. Pressure. Okay. Activate. Perfect. That's all we need. So let go.
Would cupping help on that?
Say again.
Would cupping help on that, or it doesn't help because it's underneath? It's on this muscle underneath.
Cupping is always a worthwhile idea, but it doesn't quite get deep enough.
Exactly, yeah, that's what I'm
Yeah.
saying. So it would only affect usually the fascia on top, on the
Right.
outer side.
The cruelest version of this, like I'm just saying cruelty all the time now, are these scraping-based techniques, like Graston and A-stem, where they'll use these metal tools and carve along the lines between muscle compartments. It does do a thing. Don't get me wrong, it does do a thing. It's just can be a bit brutal.
Though some people don't some people believe that if they don't feel pain, nothing happens. So.
Yes. Yeah, easier.
Mhm.
Yeah. And then I feel for, yes.
Oh, this question.
So I had to figure out going transverse, going against the grain or going with the grain. Which one was it? And it turned out it had to be me pinning the structures together, putting enough tension on the top one to distort it, and then she's moving and activating the bottom one. And slowly but surely, WD-40, hyaluronic acid, gets distributed between those layers and we finally get some slip and slide. Make like a rusty hinge, you know? You gotta spray around the hinge and then move that door back and forth. All right. Last one. Okay, I'm starting more interior. If you have to, in terms of identifying this, usually it's pretty easy. The way like, and always with sheets, by the way, be sure to keep it bunchy. Don't ever have it taut, right? That way it's like contacting here, no draft, right? All right, now I have a couple options here. I can just follow the leg until I start going downhill. Now I know I'm really close, right? Now I can feel with my forearm, like I can feel the pelvis, I can feel ASIS right now. But you may have to come up and be more precise and go, ah, there it is. That's okay to start. Or you could follow and look for the greater trochanter and then approximate up from there.
So you do the.
I usually find the ASIS. If this is usually not a problem at all, come up this way and then you'll find it. Right there.
And this is about layers, right? So would there be a need to be to have a more precise axis, like using the fingers like you did on the shoulder, or
Not
Or
as
it really
much,
depends.
only because what I'd say for the benefit here, one, perception-wise, of it being a forearm near the pelvis. So I say it a little bit related to that. That working around the hips, you're better just using a forearm because it limits like contact of the hand around the pelvis. And I think for a client's perspective, it's just that should be your default. But here, the muscles are much bigger, and you're not gonna get the nerve and the artery unless you're trying to really be like,
Okay.
cruel. So broader basic compression is the better thing to do here. Now that being said, it's a smaller person, or for whatever reason, you could use the fingers. There's no reason why not, or a soft fist. Go ahead and roll, rotate. And now I just feel for you, I don't know if you felt me surge. As she does the action, I'll feel the muscles activating, and I can discern which one is activating more. Let go. Or what part of the muscle is activating more. And I'll feel that. So I'm pushing here. I feel this part of the muscle increase in tone more. I shift my application so it's more targeted onto that area. But it's just such a tiny adjustment, you'll never see it in a demo, right?
So you want to target the one with most tension, with more tension.
That's where having them do the active movement can help you so much, because then you'll feel where the muscle
That would be
is
the
most
shorter
active.
one.
Yeah, where is the muscle most active? You want to try to squash that, because you want to be inhibitory. So you want to inhibit where the muscle is acting the most. Thus, it's inhibitory pressure. I can't look back at Tanya if I had an owl neck.
That's okay, you're gonna see probably mean face from me anyway.
That's okay.
Has nothing to do with you or the class.
Here's the mirror.
And this is interesting. On this hip, it feels more like sartorius. And on that one, it was more tensor fascial lateral.
This one feels harder to turn.
Yeah, and the struggle is much more. One more time. Now,
I almost can't do it.
admit your limitations. Can't fix everything at once, and not everything is wrong. Asymmetry is okay. It's normal, all right? Let go. We all have to adapt. The world isn't an even place, and our bodies aren't even. It's okay. So, like 4, maybe 5 or 6 actions, and then be done. Okay, again. There's a little bit more, but now we're off. But
Yeah.
Good, let go. And again. There we go. Good, let go. Good, let go. And what's really nice is one day you'll have clients where they already know what to do. You don't even have to explain this ever again. You've already had them do this 10 sessions before, right? Okay, good. Excellent. Really good. I think I mentioned this last demo, but there's a time where I feel like it does create a tactile effect that feels nice. That when I do this, I do incorporate a little bit of a squeeze action with my fingers. I'm trying to kind of lift the tissue up and away to create space in the superficial fascia. And who knows, but at least my intention is trying to say to the lymphatic fluid, like, hey, you got more room and you're being pumped, that hip joint is moving.
I gotta say, the shake after something intense is like huge.
And there is something to that. There's a little bit of a, well, you know, the song, shake it up. So after you do put the area through kind of a more intense set of therapy, there is something to just rattling everything around, getting everything free and loosened up. And what's good about this is that even if we're having to do more spot worky related applications, when you do that action, everything is being moved. Like the tissue involved with that whole area is being moved back and forth, and the joints too.